Hello, I'm Roma Villavicencio, and welcome to our Ask the Experts special. Today we're going to be talking about several topics regarding fatty liver, like the prevalence of it and the risk factors that many people face, plus what are some signs and symptoms to look out for, and how can you prevent yourself from getting fatty liver? And finally, what are some available resources to help? Joining us today are three experts from Pinnacle Clinical Research: Dr. Stephen Harrison, Medical Director and Gastroenterologist, Hepatologist; Dr. Madhvi Rudraraju, Gastroenterologist, Hepatologist; and Dr. Jacques Benoun, Physician Investigator. Thank you so much for being with us, doctors.
Thank you.
Happy to be here.
So let's start with this conversation off with Dr. Stephen Harrison. What is your background in liver research and Nash?
Well, I'm glad you asked. So I actually moved here in 1995 as part of the Army. So I did my internship, my residency, and GI fellowship at Brooke Army Medical Center here in San Antonio. During that time, I became interested in research and started investigating certain liver diseases. Early on, it was hepatitis C. And then I went off and did a liver fellowship at St. Louis University, came back in 2003 to Brooke Army Medical Center, where I spent the next 13 years until I retired in 2016, really building a career in liver disease. Again, initially in hepatitis C, we found cures for that. Then pivoted to non-alcoholic fatty liver disease, which is the #1 liver disease in the United States and probably the world as well.
That is a very alarming statistic to hear, I would say. We were talking a little bit prior to this, and you were saying that a lot of people might not even know that they have fatty liver, correct?
Yeah, there's a huge disease awareness problem around non-alcoholic fatty liver and its more severe form, non-alcoholic steatohepatitis. In fact, when I was at Brooke Army Medical Center, we did 2 studies trying to determine how common this is in the community. And we looked at people that presented for routine colon cancer screening. And these are people that at age 50 or greater were coming in just to know their colon health.
Wow.
And we asked them, well, you're here for your colon health, would you like to know your liver health as well? And we excluded anybody that had known histories of liver disease, took medications that caused fatty liver, or drank alcohol to the level that gave them fatty liver from the alcohol alone. We excluded those people. And then we enrolled the remainder. And in total, between the 2 studies, we enrolled over 1,000 patients with a mean age just above 50. And what we found is the prevalence of fatty liver in our community, in that population, is around 38% fatty liver. When we stick a needle in the liver, that's how we diagnose steatohepatitis, the more aggressive form of fatty liver. We found that 14% of that population, 14% of people in San Antonio presenting for routine colon cancer screening had underlying non-alcoholic steatohepatitis. And maybe more concerning is 6% of that population had advanced fibrosis. People walking around thinking their livers are healthy had underlying scar tissue in the liver from the fat.
Wow. Well, Dr. R, you as well practice the same medicine as
Yes.
Dr. Harrison here. What is your background?
So I am more focused in transplant hepatologist for the past, or until 2020. I moved here in 2010 to San Antonio as my first job after I finished my training. And I've been in transplant for the last 10 years for people who were not diagnosed with fatty liver, like those people with advanced scar tissue progressed into even more advanced stages with cirrhosis and complications. So those were the people I was serving from 2010 to 2020, after which I joined Pinnacle. I still have my transplant practice. But these are the people who unfortunately were not diagnosed with fatty liver early on and progressed to cirrhosis, or diagnosed and were not offered any treatment opportunities. They were told, oh, you have fatty liver, just eat healthy. That's the only thing they were told. They don't know what eat healthy means, and they were not following the diet or the exercise, and they progressed to cirrhosis and complications. So.
Well, we are very thankful to have all of you being able to clarify and educate our audience. When it comes to early detection for liver disease, how important is it, and does it really make a difference once someone is diagnosed?
Yeah, absolutely. Early detection is key. And so to do that, you have to look at risk factors. In other words, who's at risk for fatty liver disease? Is it everybody, or are there specific populations that we need to focus on? So first we should talk about the demographics relative to ethnicity.
Okay.
What we know, again, from the study that we conducted here in San Antonio and many others around the world, is that Hispanics are at increased risk, Latino Americans increased risk for underlying fatty liver disease. There is a genetic predisposition. We now know there are multiple different genes that are mutated that can lead to fatty liver. And so these genetic mutations are enriched in Latino Americans. And so beyond that, Caucasians and Asians have the next most common setting where fatty liver exists, followed by African Americans. So when we think about ethnicity, Hispanics, then Caucasians, Asians, and then finally African Americans. And then there's the demographics of this population. So at the time of diagnosis, most are around 50, as we've mentioned, but you can begin to develop fatty liver as early as childhood, as Dr. Banoon knows from being a pediatrician. Now, where do we see this in association? Well, we see fatty liver in obesity, in diabetes, hypertension, and hyperlipidemia, or even just overweight individuals. Now, this is what we call the hepatic manifestation of metabolic syndrome. So metabolic syndrome is really a combination of energy metabolism gone bad. So again, in patients that are overweight, obese, or diabetic, that's where we most commonly see fatty liver. In fact, about 70% of type 2 diabetics have underlying fatty liver, and about 60% of patients with obesity or BMIs, body mass indexes, over 30, live with fatty liver disease.
And what about those patients that you would all consider maybe lean? Are they at risk as well for fatty liver?
They are. Lean NASH is a term that's used to define non-alcoholic fatty liver in the setting of a patient with a body mass index less than 25. That occurs in about 10% of our overall population, more common in Asians where they tend to be thinner, but still it's a relatively infrequent finding in general. Most patients, particularly in the San Antonio metropolitan area, will tend to have body mass index greater than 25 and very often over 30, and those tend to occur more frequently when the two are together, obesity and diabetes, with or without hypertension and elevated cholesterol.
Well, this is all very eye-opening. I'm, running all the numbers in my mind right now, but it's very informative and important for our audience to know as well. What is the risk of liver cancer in fatty liver patients? Dr. Arya.
The risk of liver cancer, there's two scenarios where they can get liver cancer in fatty liver. One is anyone who progressed to cirrhosis, the advanced stages. Any reason people have cirrhosis, whether it's fatty liver, hepatitis C, hepatitis B, alcohol, they're all at increased risk for liver cancer. So once they have cirrhosis, the risk of having cancer is 2 to 3% a year. So out of 100 people, 2 or 3 will develop cancer every year once they have NASH cirrhosis. Whereas with fatty liver itself, or NASH, they can have cancer even without cirrhosis, which is something unique to this, and also hepatitis B. And that risk is thought to be about 0.6%, so 6 out of 1,000 people can have it. There's no recommendations for screening in people who do not have cirrhosis. Whereas if they have cirrhosis, the recommendation is to do some kind of scan on the liver every 6 months to detect the cancer early, so they could go for more curative therapies, either local regional treatments, which is where they treat the cancer inside the liver, or they could go for a more definitive treatment, which is a liver transplant. Okay. But yes, the risk of cancer is quite high, and though it is 6 out of 1,000, given that the denominator is so high with millions of people out there, it adds a big population of people out there that are at risk for liver cancer, even though they don't have cirrhosis.
And if I could add,
absolutely,
liver cancer is a growing problem in our country and around the world. The number one reason for liver cancer now is non-alcoholic fatty liver disease. And when we think about San Antonio, southern parts of Texas, this is the epicenter for fatty liver and liver cancer for our country.
Wow, that is very important to hear, as I've been saying, and also you just never really think about your community in that way until you are presented with this information. So if someone is watching, they might be a little bit concerned. What are some of these symptoms and treatments for fatty liver? Dr. Benoon, you've been quiet, but you are here with us. It is good to hear from you.
Well, there's currently no FDA-approved drug to treat Nash and non-aquatic fatty liver disease.
Which makes it a little bit scarier, I would say.
Which makes it a little scary. I mean, you could take control yourself as a person by changing your lifestyle, what we call a healthy lifestyle. So eating better, healthy choices, being more active. That would make a huge impact on your liver health and your health in general. That could be a difference maker, so it's just a matter of finding the motivation within yourself to do these changes. But there's not a drug now, and that's what we are doing at Pinnacle Clinical Research, is we're involved in clinical trials to find that drug or drugs that could help people who have Nash and non-alcoholic fatty liver disease.
Wow, well, Dr. Benoon, we heard from Dr. Harrison and Dr. Art. What is your background? You were saying you also work with children?
Yeah, so my background is a pediatrician. I've done that for 26 years, and in parallel to that, I have a lot of experience in clinical research. So I've been fortunate enough to be with this team here to help with Nash research. And it's going back to children. It's there, it's present. So this is not something that automatically happens when you're 50 and you're off the hook before that, but when you look at recent data, 5% of children already have signs of fatty liver disease, and when you're a teenager, it goes up to 13 to 17%. So I've seen teenagers who already have signs of fatty liver disease and diabetes and hypertension and high cholesterol, so their body is already getting hit with these changes. So it's very important to be aware of this, children, teenagers, their parents, and start making these changes.
Especially at a young age with children, because then they can be informed, have the knowledge to make those wiser decisions of what they're eating, putting in their bodies.
Correct.
But can anyone do anything to prevent fatty liver disease?
Again, going back to health style, I mean, it's a matter of educating the community, educating where you live, your families, how to change how we eat.
It seems kind of simple, if to do that, but I know it might not be in some areas of our world where food resources are not exactly what you would want them to be ideally, right? So what does screening for that fat, you said there is no actual detection for it, but what do you guys usually do to
So we have a very simple test. It's called FibroScan.
Okay.
And FibroScan is a liver ultrasound specific to take a picture of your liver. It's an easy test. You just need to fast for 3 to 4 hours, and it only takes 10 minutes. And it's just a little probe that goes on the side of your liver, and it takes pictures. And you take 10 pictures, and it prints out the picture, and it gives information that you could share with the patient of how is the health of your liver. And it spits out 2 numbers. One of them is what we call CAP, which is the fat in your liver, and the other one is the scarring, the stiffness of your liver. And then if you have fat and you have stiffness, then it puts you at that risk or suspicion that you may have fatty liver disease. And my experience when I talk to patients and show them this information, they are totally unaware of it, and they feel grateful that they have this information. And I get the sense that when then you talk to them about changing their lifestyles, that you've made an impression on them, because now they leave with that information saying, oh, I better change because I actually have this.
I can only imagine, the reaction you get. It's that moment where the awareness hits, and now they know what better choices they can make.
If I could add, I think it's important for the listeners and our colleagues and constituents in San Antonio and surrounding areas to understand what goes wrong with fatty liver. Why is it a big deal? And it's pretty simple. The liver is a very unique organ. It heals just like the skin does. You get a cut on your skin, you form a scab. And you don't cut the skin again, the scab eventually falls off because the skin is healed. But if you cut your skin in the same spot every day for 20 years, the scab gets bigger and bigger and bigger and doesn't heal. The liver heals exactly the same way. When you injure your liver, it wants to regenerate, it wants to heal. So whether you drink too much alcohol, you're infected with a virus, you take a drug that causes liver injury, or what we're talking about today, excess calorie intake that leads to fat being deposited into the liver, can set up a stage for what we call, a big fancy word, lipotoxicity. All that means is the fat in the liver is an irritant to the liver cells, we call hepatocytes. And they become irritated and they begin to undergo cell death. And as they die, it incites this process by which the liver wants to lay down a scar or a scab or a wound healing. And if you're able to get rid of that injury, you take the fat out of the liver will heal, and literally it'll look normal in a couple months. The problem is, over time, over decades, maybe from early life, 5, 6, 10 years, to the time they're diagnosed at mid-50s, you've had decades to accumulate this scar in the liver. And when you accumulate enough scar, we call that cirrhosis. And at the time of cirrhosis, it's very challenging to try to reverse that disease. This is the importance of screening, identifying patients early before they progress to that point. And again, when we're developing therapies for fatty liver, one of our main targets is getting rid of the fat in the liver or preventing fat from coming to the liver. And that's what we're excited about at Pinnacle Clinical Research, is utilizing all of what we've learned about how this disease works to try to prevent it from impacting the liver and, reverse it where we can.
Well, thank you for explaining that so well. And when it comes to clinical trials, what is your involvement in that?
Well, in clinical trials, the three of us function as what we call principal investigators. So we're all leading various clinical trials to treat the disease, both in San Antonio and in Austin. And we help to work with referring physicians to identify the right patients to send over. And then we work with those referrals to help the patients understand what the disease is and what we have to offer at Pinnacle Research and how research can help benefit them as an individual and then the field more broadly to help us find that first FDA-approved treatment. And the good news for the city is we are really on the cusp of finding that first cure. In fact, recently I just came back from London and presented data at our International European Liver Meeting last week, where we spoke about one of the therapies that is on the cusp of achieving approval. We showed that it was safe and well tolerated. Later this year, in Q4, so sometime around Thanksgiving, we should have the results from that trial looking at how well it helped people after 1 year of treatment. If that's positive, we already know it's safe and well tolerated. Potentially, we will have our first therapy that could be filed with the FDA. If they agree with that decision, by late next year, we could have our first FDA-approved therapy for CVS, Walgreens, or wherever.
Wow, and it started right here in San Antonio with these doctors. How incredible. I wish you the best of success in that. And you need patients, though, to do clinical trials. Why should a patient consider doing so?
So the main reason for patients to consider is, one, it is a silent epidemic. So they don't know they have fatty liver. So the first step to help is to get screened for fatty liver. Like Dr. Benoon said, the FibroScan. It's a painless test, only takes 10-15 minutes of their time, and we offer it at no cost to them so they can know where they stand with fatty liver. And the other big reason in San Antonio is our people are genetically more prone with the Hispanic population and their metabolic syndrome, diabetes, high blood pressure, high cholesterol, all those risk factors. So they start off with the FibroScan to know if they have fatty liver. And once they do the FibroScan, we can also tell if they have scar tissue forming in the liver. Then you know it is the fatty liver that is more dangerous and causing scar tissue deposition in the liver. And if you don't do anything about it over a period of time, could be a few years or longer, they could go into cirrhosis. So once they get those results, they can see how silently the fatty liver is damaging their liver. And based on that, they can decide at that point, do I want to do anything about it? Now that I have this alarm that I did not know something's going on, and now we detect it if we want to do, or if I want to continue in the same path and then lead to bad outcomes with cirrhosis and its complications.
Okay, very important to consider those clinical trials as well. Is there anything you would like to leave our audience with? You shared so much important and useful information about fatty liver. Anything else, doctors, you'd like to mention?
I just want to, I think the plug in here is that we need to be aware of Nash. It's present, it's growing. We are all at risk of this disease, and awareness is probably the first step to make a difference.
Okay.
And I would just say, listen, if you're overweight, if you have type 2 diabetes, high cholesterol, or high blood pressure, or a combination of those, you are at risk. If you're a type 2 diabetic, you're at the greatest risk. In fact, some of the recent guidance documents coming out suggest that if you are a type 2 diabetic, you should be screened for non-alcoholic fatty liver disease, given the high frequency that it's seen. 70% have that. Because we want to identify early on if you're in that at-risk group that could progress in their liver disease, again, silently over time. We want to grab that and reverse that as quickly as we can, or at least have a discussion around lifestyle modification, things that you can do right now today to halt the disease and begin to reverse it. And where you can't achieve that, that's where we step in and help with potential clinical trials to help find a way to get your liver better.
Okay, well, thank you so much. Dr. R, did you want to say something else?
Yes. So people think, oh, it's just fatty liver, which means I'm fat, I have fat other places, it's fat in the liver, but fatty liver is now the #1 cause for liver transplant in women for the past several years. In men, it's only second to alcohol. So it just shows how serious this disease is. And it's the #1 cause for liver kidney transplant overall. So it just shows, and it doesn't mean fatty liver is damaging the kidney, but the metabolic syndrome is also causing damage to the kidney. So just shows how serious the disease is, and people can't ignore. And when they have this opportunity in town that is available for them to get screening, no one should not take that opportunity on. And Dr. Harrison is the world expert in fatty liver disease. Wow. He travels all over the world spreading awareness, trying to find treatments, and we are honored to have such an expert in San Antonio, and
Yes, we are.
they don't have to travel anywhere to see him, right?
Absolutely. Well,
so they
you.
need to come here and get screened. And even if they're not interested in clinical trials, when they come to us, we educate them on where their liver stands, what they need to do in terms of diet and exercise. It's limiting all the sugary drinks. Biggest culprit is sugary drinks, and limiting the simple carbs like the bread, pizza, pasta, tortillas, rice, potatoes, and other things that they could do that we can go on an in-depth consultation with them. We have physicians and advanced practitioners available. Everyone who comes for a FibroScan will see one of us, and we educate them, and we do want to spread awareness, and when they come, they can even bring their family members. So all they need to do is fast for 3 hours, come to us, and we can get a scan done.
Well, thank you all so much for wanting to help the community and for your passion for what you do. It was really nice to have you here today. And if you guys need to get in touch with them, they are Pinnacle Clinical Research over at 5109 Medical Drive, Suite 200, open Monday through Friday, 7 a.m. to 4 p.m. For more information, you can give them a call at 210-405-8083 or go to pinnacleresearch.com.